She oversees all the clinical departments at RAMS and supports the development of new clinical programs across the organization. So please join me welcome our first speaker of session 2, Christina.
Thank you. Thank you, everyone, and thank you for the previous panel. It's very inspiring, and I've heard a lot of panels of people with lived experience, but this one is very special, and it helped me reflect on my own life and my own family, as well as my work-related family. So thank you again for the previous panel. I mean, that's very inspiring, and it really humbles me to be a healthcare professional. And thank you, Lotus Project, for allowing me to speak today. And in talking about prevention and early intervention, and the previous panel made me think a lot about how if this happened when they were 3 years old, what would have been different? And I always say that people say, well, I'm a child therapist. I work with kids 6 to 21. And I said, what happened before then? I mean, kids happened before 6 years old. So I am really blessed that my first career was a preschool teacher. I go totally off topic right now. It wasn't in part of my planned speech, but I want to say a little bit about myself. That my parents were both healthcare professionals. They met during the Second World War in China at the hospitals where they were trained, and so I grew up in a medical professional family, and Western medicine was how I grew up with. In anything, like you take a pill, or we even have a bottle of medicine in the cabinet that kids can access to for stomach pain. It was just like, we knew what to do. And so when I was 5 years old, family friends would say, hey, Christina, what do you want to be when you grow up? And mom said, oh, she wants to be a nurse. So I always thought I wanted to be a nurse, but at least work in a hospital, because that's what I grew up with, being a happy place. Actually, hospital was a happy place. My dad worked in a hospital, and every Christmas and New Year, Chinese New Year, we would go to the hospital to visit. And I always received gifts from my dad's boss, because I thought that's what hospital is about. You get gifts and you're happy. And I also happened to be born on Christmas Day, so we always visited on Christmas Day. And I was the one who get the special trip to go to the maternity ward to see the babies. And I was reminded, you were the loudest crying baby in that. So that's my association with that, and I thought I would be one of those. But anyway, fast forward to my career, and we talk about early intervention and how early, like how you are shaped by not only who you're born, but who you're born into. Again, I didn't think about this when I was preparing my slide. So anyway, I'm going to talk about Fuyao Project, which is how it brought me to RAMS, Richmond Area Multi-Services in San Francisco. So again, my first career was I wanted to be, I want to work at a hospital, but somehow when I went to college, my major was supposed to be biological sciences, but I failed organic chemistry. So that changed my career. My sister is a AP chemistry teacher, but I do not comprehend organic chemistry. So then I was looking, well, like, what else can I do if I fail chemistry? So I found that I like kids, so I ended up in human development in my undergrad, and then my first career was being a preschool teacher because that's resonate with me. But then I thought, since my older brothers and sisters all had a master's degree, I should have a master's degree, and I have no idea what to go. And a friend of mine say, well, counseling. I said, oh, that sounds interesting. So I went into not knowing what I was getting myself into. But fast forward, I got a degree in counseling, marriage family counseling, not that I even knew what I was going into after I graduated. My first job was actually a counselor at a preschool. So that helps because I knew about preschool. A few years, and that's the time that my boss, who was getting a Ph.D. in early childhood education, and she said, Christina, this is an exciting time. That's in the early 90s. And she said, this is an exciting time because there is going to be a marriage between mental health and early childhood education. I said, okay, oops, I think. That's exciting. I have no idea what she was talking about, but sure, that worked. So I started seeing little kids at preschool in child therapy, family therapy, and group therapy, as well as supervising the teaching staff. So anyway, I did that for a few years, and then so then in 1999, then I've heard about Dr. Evelyn Lee, who was executive director of RAMS, and she was like an icon in the Asian community mental health. And I thought, okay, I get to meet Dr. Evelyn Lee. And I was in the training, and Evelyn talked with me, and she said, oh, Christina, you work in preschool, and you're a licensed marriage-friendly therapist. I have a new position. I have a new program called Fuyao Project. Would you like to apply? And I thought, sure. So there it is. It's called Fuyao Project. Fuyao Project is, the name is the mission of the project. It means support and promotes the well-being of young children. So it provides prevention, early intervention. So it's different than in-depth psychotherapy, and it's consultation. So it makes sense for me because I was a preschool teacher, and then I was a counselor at a preschool, and it was a natural thing to do. Mental health consultation. Actually, I was a mental health consultation at a non-clinical organization for a few years before before Fuyao started. So it's a consultative model, and currently we hire clinicians, people with either MFT or MSW degrees, and have some experience working with children and family to be in this position. So for this particular program, when we started in Chinatown in 1999, most of our childcare sites were in the Chinatown area, serving Asian American and Asian immigrants. And most of the Asian immigrants were from China. And so when we started, it was a small project. We had $400,000 budget for the year, and we had 6 human beings and 4 full-time equivalent, and we served 11 sites. So at that time, we were able to spend 1 full day or even 2 full days at each childcare site. Fast forward in 2025, We have 8 full-time equivalent consultants. We have about 10 human beings, including the directors and the clinical manager. And we serve 50+ sites. So economy, right? So the good thing is more child care centers and family child care homes have access to the service. The bad news is the budget did not increase that much. Our budget has tripled, but with the cost of doing business and the cost of living, we can only hire 8 mental health consultants, but we have to serve 50+ sites. So the time at the sites would be like 3 times a month or once a month. So the frequency is definitely different. What is mental health consultation at a child care setting? So we talk about stigma, right? So I always say the word stigma is stigmatizing. I actually don't like the word stigma, and I would say that it's just different vocabularies that means different things to different people. And so in the childcare world, mental health is social-emotionally development, right? So we talk about fine motor development, large motor development, and cognitive development, and social-emotionally development. So this is all about social-emotionally development. And that kind of vocabularies resonate with the preschool teachers and childcare and the parents. So it's natural in that environment. And ability to express yourself in a full range of emotion, which I think in the previous panel talk about the lack of vocabularies to express yourself in your own language. So how can we express yourself with or without verbal language, right? And relational health in multiple settings. So kids start to be exposed in different environment outside of the home when they start preschool. How do they interact with the childcare providers, with each other, and also the relationship between the adults in the childcare setting. And consultation in a childcare setting, I think that's a little bit complicated for some of our newer staff, because my imagination of consultation usually is people who have been in a career for a number of years and maybe semi-retiring as a therapist, and you become a consultant. But we are hiring like early career mental health professionals to be mental health consultants. So how can you be a consultant when you are still learning? So how we help our newer consultants is really to be humble. And how do we partner with our consultee? So we may be the expert in mental health, or we come in with a mental health lens, but the teachers are the expert in education, in early childhood education, and the parents are, and the parents are the and this is a ghost here, and the parents are the expert in being parents. So how can we partner together to support each other? And please don't come in as I am the expert and you are the ones who is going to receive my advice. We lose people that way. So yeah, this is the statement that my boss used to say. Paula Motentosen, that's her name. That's my boss. in 1990. That's the childcare director. She was saying that, yes, this is going to be the marriage of early childhood and child development and mental health, but with the cultural and value practice lens and in the prevention and early intervention. So that's how I started my career. So in how Fuyao figure out what to do, right? So one thing is I went to grad school. I was the only Asian in the class, and then we tried to figure out how to do cultural competency thing. I actually went to one cross-cultural counseling class that Daryl Su and Al Jones were the co-teachers. Those are like the icons of Asian American psychology and African American psychology. I was really blessed to do that. I didn't know they were the icon, but they were. But that's the only class. And then every other, oh my God, 5 minutes. I need to speed this up. Okay. Unfortunately, so if you look up early childhood mental health consultation, there's the Center of Excellence for infant and early childhood consultation is Georgetown. It used to be part of Georgetown University, and then the California Infant and Early Childhood Mental Health Consultation Network. The first one forgot about Asian American. The second one don't even include Asian Americans. Thank you very much. So Fuyao Project have to provide mental health consultation for the family childcare providers in San Francisco because the California Infant Early Childhood Mental Health Consultation was supposed to provide that service. Okay, so we think about holistic support, right? So we think about attachment theory and attunement to the children, attunement to the family, and as mental health consultant, attunement to the teachers, to the adults around it. And we factor in the culture and the value of the individuals, the families, the childcare centers, and the community. I love about food, and I love about eating, and I love these pictures about different how food and kids are related. The one with spaghetti on the hair, that was my son. And after dinner, we will put the whole baby in the bathtub before we undress him and bathe him, because that's how he ate. And he sort of still does. He's in his 30s. He still eat like that. And then the one on the upper left-hand side was how my nephew was fed. And I was taught, because I was taught in Western psychology and Western child development. So I was taught that the baby on the upper right should be the way, right? You should let the child be and do whatever they know how, and so that they would development. And then I was taught as a Chinese, that you're supposed to feed your baby and make sure they eat a lot and stay clean. At the end of the day, it actually doesn't really matter. They all grow up and they all eat. And I like this picture of Pacific Islanders, because we always say API is like, where are the Pacific Islanders in the picture? So this is, I like the locus of control. Like Western psychology is about the individual, and my daughter, like I learn everything from the kids, from my clients, my kids, my supervisees. When she was in 2nd grade, and her teacher said, well, Hannah, what do you want to be when you grow up? And she said, I want to be a kid when I grow up. So there. So Western psychology is about the individual, right? And but a lot of the Asian families is about the family, and then with Pacific Islanders, it's about the community. So when we provide mental health consultation, we like how do we think about the lens about what's healthy? Okay, I have stories. I know I have 2 minutes. Okay. I will maybe say one story. So now, full disclosure, I started with mental health consultation 26 years ago. Did that for 6 years, also as leading the project. I have not actually done mental health consultation for 20 years, but I supervise the directors who have been doing mental health consultation for the last 20 years. So I use some of my own experience and some of my learned experience from other people. But I remember when I was newer in the business and as a mental health consultation, how did I join to gain the trust of the teachers, because the teachers have been around for a long time, they have taught for a long time, and they have also received mental health consultation for a long time. So who am I to be the consultant? Part of the thing is to how do I gain the trust, and I try to, when they ask me a question, I end up asking 10 questions. So I'm trying to be reflective, try to help them think, which was helpful. But at the end of the day, I don't need the mic. But at the end of the day, I asked one question. I mean, they asked one question. I asked 10 questions because I don't have the answer. But they need to have something tangible to gain my trust. So I think because of the number of reasons the kids actually needed additional services, whether it is developmental disability, that we refer them to regional center. If it's academically disability, which includes speech and language, we refer them to the school district. So they have something tangible to, or if it's more psychosocial situation with the child and or with the family, we refer them to community mental health. When they have tangible means to get resources, then they thought, okay, at least Christina know where to send them. And so then we get the trust. I gain the trust from the teachers, and then I can ask more questions. When they ask me a question, I can ask. They can tolerate me asking them 10 more questions to understand what the situation is. I will have to stop because my time is up. And maybe I can come back to a few more stories after that.
Thank you, Christina. Thank you. So our next presenter will be joining us on Zoom, Brian Keum. Dr. Brian is an associate professor in the School of Public Health at UC Berkeley. Trained as a counseling psychologist, his research focuses on mental health disparities among racially or ethnically minoritized communities through a culturally informed intersectional lens. So Brian is ready.
Am I ready? Wait, not yet.
No, not yet. Okay.
Wait, let me share my screen. Let's see. Is that working?
Yes.
Okay. All right. Thank you for the welcome, and I wish I was there in person. I can actually feel like the energy that's through the screen. There's like a lot of excitement and connection happening. So it's a bummer that I, could not make it in person, but nonetheless, I really appreciate having me over Zoom and really appreciate the opportunity to talk about some of the work that we've been doing. And actually, I'm kind of really appreciative of Catherine's presentation as well, because some of the things that she talked about, maybe there were some implications from our work for that, and vice versa. So it's really nice to hear about her work in RAMS. I've actually also connected with Catherine recently, so it's clearly a small world in our community here too. So I'm currently at UC Berkeley School of Public Health. I also run the Digital Equity and Anti-Oppression Lab, and I did get my counseling psychology PhD, and so I have a therapist and counselor background. So it's really nice to share space with folks who are also thinking about, the mental health service provision issues and so on, and the related, of course, disciplines as well. So today I'm just going to talk a little bit about some of the work that we've been doing on the gender racial socialization, because there has been a lot of implications that could be useful when thinking about the stressors across time, maybe as starting as early childhood, and then of course trauma that could also, chronically and cumulatively impact Asian American youth who are growing up into their adulthood and beyond. And based on that, so what are some of the more flourishing and affirmative experiences or futures that we can hope for? What are some of the aspirations that we can have for a more flourishing and affirmative life, for us? And so we've been taking a look at that through the gender racial frameworks. I'm going to share some of that with you today. So I'm going to start here because obviously, many of you probably still remember this when the Atlanta spa shooting happened. That was reverberating throughout the nation. A lot of, people were, experiencing a lot of trauma-related symptoms and responses to this. And so the Asian American women who were killed in this shooting, traumatic event, was certainly not something that, of course, it's the only event, but it really transpired across the nation in very sort of, violent ways as well. And there was a lot of commotion and, community action around this as well. But one thing that is really important that came out of this is that this wasn't just something that, happened because of a particular anti-Asian hate, incident. It was also about, specifically on mostly about Asian American women's experiences. And so a lot of the assumptions and beliefs that could sort of underlie some of this kind of violence and hate and murder that can happen is because of how, for example, if you think about the gender racial position of Asian American women, that they are sort of assumed and stereotyped into some of the ways that they are represented here. So feeling like they are assumed to be submissive, there's fetishization, there's invalidation of their womanhood in the media, and there's also this assumption that they are all kind of the similar, appearing women, despite all the different ethnic differences and, individual differences in their self-presentation and, images that they would like to portray. And so this is a, historically, long-standing, stereotype and assumption that's been around ever since, Asians have been immigrating into this country. And I will talk about the men's side in a little bit, but this is sort of something that underlies a lot of the experiences that we might see at the individual or even institutional and systemic levels. And it sort of spans across all of those domains for an Asian American girl or woman who's growing up in this country, who's going to be experiencing this, even as early as early childhood. That is sort of um, the reality that we have not been really, recognizing, significantly. And so what's really troubling is that if we have sort of looked at this experience and seeing how it affects mental health, and there is a significant link with, mental health issues like depressive symptoms, severe and persistent mental health issues. There's a lot of internalization of negativity about themselves as well, because those assumptions and stereotypes really invalidates their sense of self. And so the continual sort of internalization of that actually affects a lot of self-negativity that, when you think about the depressive state as well, there's a lot of risk for things like self-harm and suicide risk, which is actually really becoming an increasing trend in our community. So, in our recent study where we looked at some national data on this, there has been a significant sharp increase since about 2004 for Asian American women. And so this seems to be continuously increasing. So it's kind of it's been sort of overlooked in the public health, really. And so we don't have a lot of data on Asian American suicides to begin with. And then if you look at the more at the identity differences level, then there's even more nuanced differences that you see that have gone sort of under the radar, so to speak. And so if you think about even the gender racial experiences and stressors that I just talked about, somebody who is experiencing a gender racial microaggressions based on those assumptions and stereotypes, if you let's say on a measure that you're reporting maybe 1 unit increase, sort of, let's say, I'm experiencing reporting more gender racial microaggressions than a person next to me. And chances are that you're likely to be reporting 3 times the likelihood of suicide ideation. So these experiences are kind of, really significantly affecting, how an Asian American woman could be thinking about themselves. And yet it's only been sort of coming to the fore in recent decade, even though historically there has been a lot of scholars and clinicians who have been writing about this and who have been alarming the public about this. It's just gone, under the radar. And then, as I talked about before, the self-negative internalized racism, that's actually even, because they work in tandem with gender racial microaggressions experiences, about 5.6 times more likely to actually report suicide ideation. So that's a very staggering number if you think about it. So when they work in tandem, it's no wonder that this is a significant culturally informed trauma-related, risk for suicide among this population. But again, we don't have the data at the national level, and there are studies that kind of look at even the Atlanta spa shooting that I mentioned in the beginning. They have looked at sort of how after that event, how does that actually transpire to the mental health state at the population level for Asian Americans, but it doesn't really, they haven't really found anything about how it actually specifically affects Asian American women's mental health. But the problem with that is that there is no data that's specific to that population. So a lot of the variables or the ways that they are assessing experiences at the population level, they don't look at the gender racial experiences of this population. So there's a very strong disconnect. That's why the data is not able to tell us what's actually going on at the population level at this time. So when we think about the gender racial microaggressions experience again, this is a lifelong experience. This isn't something that you can avoid if you live in this country, right? So starting as early as childhood, you're going to be experiencing this across the lifespan. I have experienced it. I'm sure some of you, many of you are experienced it and experiencing it. There's been a lot of sort of a wake-up call, I think, in our communities, especially the COVID-19 pandemic, about what's anti-Asian hate. But that's been around ever since, even before the pandemic. So, and it's been around in many different forms. And of course, gender racial microaggressions or racism is also, of course, another dimension of that. But one thing that is really sort of alarming is that even though this affects, us and sort of, as Catherine actually mentioned a little bit, as early childhood, we actually know very little about how it has been impacting us across the lifespan. So a lot of the research that we do on these kinds of trauma events is actually around adulthood, so college aged and beyond. And so whenever I ask this question, when I give a presentation, people generally say they had no space, they had no interaction, they had no opportunity to actually seriously explore who they are, not just as an Asian, but in terms of in relation to their other salient intersecting identities. And so who you are as an Asian American woman, who you are as an Asian American man, who you are as an Asian person with an LGBTQ plus background or other salient identities, class, immigration status. How does that all kind of relate to who you are? And so that's the beauty of the intersectional sort of approach, is that we can sort of start to uncover some of the understudied, overlooked, underrepresented experiences, even within our community. And that also actually helps with the broader public's understanding of what's actually some of the more culturally relevant factors that are salient in our lives. And so and the reason why I say that is because if you think about a particular developmental model in psychology, I guess, for instance, the Bronfenbrenner's ecological theory model is a very popular one. But there's many different domains where exploration of your identity can happen. And so here you see one diagram of that. I'm actually not a big fan of this model. And so because the reason is, yes, as Catherine mentioned as well, we are taught within the Western psychology framework. I've gone through that, and I've actually had there was only one cultural counseling class that we had to take, in my training too. And which is really shocking given that it's still the same case. But um, if you think about this model, it's a very white model. The developmental world is very white. It doesn't account for race or even gender in many cases too, actually. And it prioritizes a white child's well-being within the systems, and the systems support white population, but the other racially and ethnically minoritized populations are an afterthought, or they're actually designed to keep them out of the system, right? So that's actually supposed to support them. And so it actually misapplies a lot of the assumptions about how these domains could socialize a child over time. And so, for example, an Asian American boy who grows up in this country and experiences a lot of gender racial stressors and ideals and messages, that is not captured in this model. So to apply this to then work with kids of us in our community, I mean, there is of course some benefits and implications that could also apply, but generally speaking, there could be a lot of disconnects that can arise from this. And so one of the reasons why we have been looking at the socialization aspect is because then what are some of the actual sort of messages and ideals that could actually really help to understand what's been the gender racial experience, for example, let's say an Asian boy growing up in this country. And actually my doc student is actually expanding the work to study the Asian girls and women's experiences as we speak, and she's out there interviewing participants already. But we have conducted sort of a qualitative study to look at what are some of the ideals and messages that affect their growth over time. And so these are some of the ideals that were found in the themes of our qualitative data. And so I'll take you through some of them and present some quotes from the data as well, because that helps to exemplify some of the stories that they tell. And so and for that, I'm kind of curious what what were some of the stories that were shared in the previous panel, because I would have really wanted to hear some of that. But and as we go through these domains, we have actually laid out a nice multi-level model, right, of what the actual across the levels, individual, parents, family, community, institutional, cultural, ideological, what are some of the more themes that apply at these different levels. So you can see it here, as well as some of the maladaptive outcomes that can come from this. And but of course, some protective and factors that can actually help, address some of these influences as well. And so this ties together, but let me, go into some of these themes. And so these graphics were created by some of our students. It's amazing, that they're really talented with, our graphics, art design, all that. But there's a lot of, in terms of intergenerational parental ideals, most of them are kind of talking about how they're bought into white supremacy, right? So even at the intergenerational parental ideals, there's a lot of white idealization that already happens in our community. And so it is happening without question. And that affects, of course, the messages that they might receive growing up as well. And so, we're not necessarily, penalizing, this process, but in this system, as people are sort of pressured to integrate and assimilate and, within their immigration struggles, this is something that happens, and it's kind of, sometimes it happens without question. And so there is that systemic, lens there. And then this is particularly the case if you live in a geographical and neighborhood influence, where you are living in a very predominantly white community. And so somewhere like, in the Bay Area, wow, I mean, I just moved there. There's actually, I've never been in a community with such vibrant Asian culture and, diversity. But, where I was, growing up in Canada, actually, I was actually the only Asian kid in my elementary school. And so that's a very stark difference in terms of how one can start to see themselves as an Asian person, right, within this country. So the influences are much more profound. Of course, there's challenges in both locations, but in terms of the gender racial stressors, that's, there's some more exacerbation there. And then, of course, the multi-level gender racism that happens across many levels, not just individual. Somebody saying, something that's gender racist to you, let's say as a boy. One person was saying that they were, keep made fun of in their elementary school that they have a small, like this, gender racist stereotype of Asian men in general, right? So, think about it. If you're a parent, think about this. Like, if your boy comes to you and says this, like, how do you respond to that? Like, how would you then talk about, what that is, and would you be prepared to do that? Would you ever even think about, right, talking about this with your kid, right? But it's happening in their school, right? Sometimes they actually might not even bring it up to you because they feel ashamed, or they feel like it isn't something that you talk about. And so, and what we also found really striking is that even within family, it's happening. So there is a person who even said the sister told me that Asian men are boring and unattractive, which was really, saddening for us to hear. And the participant was, and mind you, all of these interviews, we were really taken aback just how, ashamed the men were, and they were initially not willing to talk about a lot of these experiences, but they were over time able to, share openly some of these shameful experiences. And then what you see, even at the workplace level, at the institutions, you're always passed up for leadership positions. For example, compared to a white person in the company who might not, who actually might have less experience than you. So there's a multi-level aspect of it. And some of the examples of some of the gender racism piece, right? So feeling like a floating brain walking around, lacking any personality, sexual appeal, and only worth it for knowledge. And then so, what ends up happening, what a lot of these participants said, is that they start to erase their identity. They start to erase who they are as an Asian boy, as an Asian man, and they start really hard to fit into the white sort of masculine expectations, presentations. And so, they start to, there's things like, really being preoccupied with sort of your, body presentation, substance use, even, that I will talk about in a little bit. But if you're actively trying to erase your identity by engaging in these integrative and assimilative experiences, that's becoming very, toxic, right? Because you're actually invalidating your own sense of self. And what was also related to that, was seen as salient, is that when they try to actually talk about this, in their families, with communities, in schools, there's a silence. So nobody wants to actually talk about these experiences. It's a very shameful experience. And then when they actually try to share the feelings and emotions about it, it's taken as something that they should just get over with. And a lot of them were actually said that their parents told them, just go study harder, just be successful, and these things will go away. When the truth is that they don't go away, right? So a lot of people, when they encountered that, they started to continue to shut themselves down to the point that they just lock themselves up. The shame is continuously internal, and you can see how that can also breed a lot of risk for behavioral risk, such as substance use and suicide ideation even. And so this quote was really jarring to us as well, where they said they were always on the defensive. There is no sort of healthy way of developing an Asian male identity. And they were always told to kind of ignore it or minimize it whenever the topic of gender racism comes up, gender racial experiences come up, and feeling dislocated. And so a lot of shame, right? So a lot of shame that you can kind of imply from all of the stories that I've shared with you. And what's troubling is that shame is very predictive of suicide ideation. And so I showed you about the national trend earlier on. A lot of the Asian boys and youth and men also increasing in their suicide deaths in the recent decade. And so that's been, again, under the radar, and we know very little about the culturally informed risk factors there. And the shame is clearly one aspect that has to be really explored at a greater depth. And then substance use is also associated with that because a lot of the shame drives use of substance. And because the shame is also tied to maybe them feeling like less manly, not being man enough in this country, they might engage in more compensatory behaviors like excessive, bodybuilding, for example. And there's the mental health, conditions tied to that, or even alcohol use, excessive problematic alcohol use, which is particularly common in certain ethnic groups, such as Koreans and Filipinos, for example. And so those are sort of again, it drives health disparities down the road. And so it's a really, if you think about it, these kinds of lifelong risk factors across time, since they have been going under the radar a lot, even at the public health level. And so there is not much support and data around this, which then continues to feed that vicious cycle. I'm speeding through a little bit because of the limited time, but I'm hoping to get you the most representative things here. And so one thing that was particularly deafening to us and unfortunate is that all of the participants said they had to suffer in silence. There was lack of support. And then what that ends up being is that you start to blame yourself and resorting to your own way of trying to cope with things. So things like substance use that I just talked about, things like compensatory behaviors that I just talked about. But even beyond that, always trying to now mentally and psychologically and socially thinking about what can I do to then just make sure nothing happens to me in this way. But that's really hard to do without a social support, right? Because social support is going to be one of those things that really you need growing up across youth, adolescence, college, into the adulthood. If you're not able to benefit from that, it starts to really erode your mental health over time. And so that disconnect of not being able to find social support because of the shame and the silent internalization was really detrimental. And so a lot of them actually go into college, for example, and they don't have good coping skills. And so they start to realize that this is an internal toxic combination. And because of the lack of social support, there's this continuous deterioration that could happen, especially when they hit emerging adulthood, is when they talked about how, because I just started to realize who I actually am, I have this sort of epiphany about things, about reflections about the things that I've experienced, and starts to really almost provide like a trauma response to them in many ways. So overall, this is something that we saw as a result, is that for Asian American, boys and men, that there is some kind of fragmented socialization happening in terms of who they are, and so always feeling like they're stuck between the two, and always not being able to feel seen in both ways, in the ways that they would like to be, and so within their own communities, and in the public, and in the Western, societal context as well. And so, and obviously, these experiences are not totally generalizable to all the men, right, in our community, or Asian American men in general. But I think they do signify some of the shared challenges and struggles that they do face over time as they grow up in this country. So not everything is right doom and gloom, and I mean that was sort of how we felt a little bit as we were interviewing them, because I can tell you that our questions were not about just negative experiences or invalidating experiences. We were actually also asking about, okay, tell us about like positive, right, flourishing experiences, affirming experiences, and based on our interview of 15 Asian American men, the unfortunate thing was that they did say that they had some good affirming experiences, but it was rare. And so the key is rare, is that even though they were able to get some, small dosage of these experiences, because they're rare, it was almost like, trying to really squeeze every drop when it does happen. And so, but that still tells us really, great insight, right, into some of the things that we can emphasize or even try to facilitate even more within our society, not just within the Asian American communities, but in this society as a whole, right? So these were some of the domains that we have identified in terms of their affirmation experiences. And I'm going to go through some of them in detail a little bit. As I talk about the some of the, I guess, the clinical implications here. But if you go back to this chart that I've mentioned before, this multi-level protective factors piece, this was where we kind of saw at different levels how these affirmative experiences could actually sort of resist, address, and kind of undo some of the gender racial stressors and gender racism, even across time. And if they're able to experience these aspects, then you can actually start to balance out, right, some of these internalized gender racial issues and stressors. And so if it's possible for clinical work, right, to really focus on countering these gender racial stressors and internalized, oppression, and at the same time simultaneously cultivating these affirmative socialization domains that I just showed you here and here as well, then that would be probably some meaningful work that can be done, especially even if, let's say you have an Asian male client who comes in who feels really like they've internalized a lot of that gender racial stressors and images about themselves as being negative in this country. Those are some of the ways that maybe you could enter to sort of start to provide some reframing and social support and ways to really start to affirm who they are and start to address some of those issues. And what we are currently doing is we're actually developing an assessment tool to actually assess the level of affirmative socialization that they might have experienced. And so these are the domains that we have examined, and some of the questions that we ask about how much did they experience things like positive regard about themselves, positive intimacy, body positivity, emotional connection with other Asian American men, critical education, how much they've experienced affirmative media representation, community representation of themselves, Asian American male mentors, community engagement that they do with others in the community, some cross-racial friendships and male solidarity. And so these have been the domains that have been coming up where we could see how if you experience more of these, that there is links to more flourishing and affirming outcomes for individuals. And so we're excited about this because this could then, we're hoping to translate this into more community engaged formats and really work with community partners to see how interventions can be developed or ways of psychoeducation or outreach can be done, right? So that this is sort of translated into many different domains of a person growing up in this country. So there is that. These are just more detailed definitions of each of the domains that I just mentioned. So I think the slides are going to be shared, so you'll have this anyway. So I'm not going to go into to the detail here, but I think what the final thing that I would like to just conclude with is that we're just as it was talked about, Catherine, and probably the previous panel too. We're just grateful that these stories can be shared, that these stories about participants who we had to really develop a strong relationship with before they could actually share about these experiences. And that's also the reason why I asked you with the mentee thing, how much space did you have? Because can we sit down and actually think about how much space we're allowing ourselves to talk about these stories that we actually experience in a shared way? And so, how do we then create community and shared collective vision for a more flourishing future in our community? And so the fact that we have this conference, and thanks to the Lotus Project and other organizations, that we have the space today. And again, I wish I could be there in person to really, experience that. But again, I'm just glad that I can participate through Zoom and share some of these implications. So thank you so much. Here is my contact information and some QR code for it. Hopefully that one works. But thanks so much, and thanks for your attention. So that's all for me.
Thank you, Brian. Okay, so I would like to introduce our next speaker. Dr. Catherine Vuky is an assistant professor and program director at William James College, where she founded the first national Asian mental health concentration. She also serves as at South Cove Community Health Center as Director of Training and Clinical Policies, and is the Associate Director of the Behavioral Health Department. So I'll go ahead and hand the mic to her. And I'll start the presentation. Okay. You should be able to move the slides.
Okay, great. Thank you. Okay, I'm glad I get the microphone because I don't like standing here at the podium. So, good morning, good afternoon, everyone, I guess. Thank you so much to the Lotus Project for inviting me here to be able to speak about the work that I've been doing really for the past 25 years. And in the introduction, I really hold two roles. So I've been a psychologist working at South Cove Community Health Center, primarily serving Asian immigrants and refugees. And my specific population is Vietnamese refugees. In addition, I'm also the assistant professor over at William James College and director of the Asian Mental Health Program. The work that I do for both really is intertwined. My clinical work really informs my research, and my research makes me a better clinician. So what I want to address today is really helping parents address anti-racism with Asian kids through interventions and conversations. It's not moving. Oh, I have to do that. Okay.
Okay, your slide.
Okay, good. So as we all remember, back in the day when the pandemic hit, it was a monumental event, not only just for Asians, but for the world. And we've heard racism, discrimination against Asians has occurred many years before. Asians have been here since the 1700s. So this was nothing new. But however, when the pandemic hit, it was particularly disturbing for our Asian communities. So in my clinical work, every day, stories would come up. And I wanted to I kind of set the framework for the work that I do with my research. But I wanted to share a couple of quotes during that time. One of my, it was a young woman, said that she was at the grocery store and she was bringing her groceries to her car, and a white woman confronted her. And at one point, the woman said, "It's people like you is why we don't have masks and toilet paper." Do you remember when we were hoarding toilet paper? And so initially, a lot of my Asian clients would just walk away, don't know what to say because they were afraid. But this one young woman actually decided to have a conversation with that white woman. And she said, she was able to say, "We're all afraid. We don't know what's happening. We're afraid, I'm afraid just as you're afraid." And whatever the conversation, however unfolded, my patient actually said, "Please, take my toilet paper." And in that moment, that white woman actually took a step back, and she was tearful. And I'm sure there's more conversation, I'm just summarizing, but she actually apologized. And so that was one of the more affirming stories. But there were other stories too, where a patient of mine came in, non-Asian, looked at me and said, "I look outside and it makes me sad to see people wearing masks. I don't want us to become like those countries where people wear masks." And internally I asked, "What do you mean by those countries?" Right? And so as this was happening, clinicians, we were also at the forefront of it. How do we respond? And so these were conversations that we were starting to have with my colleagues. And then these are two stories that really started the work that I did in helping parents talk about anti-racism. So in my clinic, at the time, a Vietnamese mother was in a domestic violence shelter, and she was relocated to a mostly white neighborhood. And during that time, she didn't listen to the news. She didn't understand English. So one winter day, when it was a little bit warmer, she took her son out to the park. And she said to me, she thought it was a little strange that as she was walking to the park through the neighborhood, she would see all these families, mainly white, look at her, pick up their child, put them in the stroller, and walk away. But she didn't really know what to think of it. So as her son was playing the sandbox, she goes, "Great, we have the whole park to ourselves." And then something happened. So as the little boy is playing in the sandbox, another boy who's white came up to her son, grabbed his mask and punched him. And as her little boy cried and said, "Mommy, what did I do wrong?" She didn't know what to do, so she asked the little boy, she goes, "Why did you do that?" And he said, "Because he wasn't wearing a mask." He was. And what messages was he receiving in order to go and attack another child? That was one story. Another story that came in, an 8-year-old boy, he was from China, he had just immigrated a year prior. So he was referred to me for depression, anxiety, and self-harm behaviors. And when I had asked him, "Do you know why you're here?" he said to me point blank, "I am bad." And I had asked him, "Why do you say that?" So he says he was in his classroom, and the other kids were making fun of him. And they were saying, "Oh, you're stupid for eating bats, you're dirty." And it went on and on and on. So, what do we tell our children? The kids, turn to an adult for help. He looked at his teacher. His teacher looked at him and said, "They're just kidding, get over it." So what did he do? He internalized it, and he went home, got a knife, and started cutting himself. Then that was how he was brought into the school nurse, and then he was referred for therapy. So in that moment, I turned to the mom, and I said, "What do you make of this? What do you think?" And with tears in her eyes, she said, "Well, isn't it true? It came from China." So as more stories were coming through, it really dawned on me that parents, adults, don't know how to respond to children. So how, as we as clinicians, how can we start having the conversation? How can we start helping children understand what is going on? And that is not their fault, and they are definitely not bad. But again, these are two very pivotal moments in my clinical experience that then I wanted to do something. But before I talk about the parent guides, I wanted to remind people again. So during this time, Stop AAPI Hate was gathering stories and recording and reporting on the incidences across the country. So some statistics. About 11,500 incidents were reported between March of 2020 to March 31st, 22. Of all the incidents reported, about 42% were hate, around hate, and that it actually increased to 6,200 in 2021. 1 in 3 parents expressed concerns for their child being a victim of AAPI hate on their commute to school. I do remember when we were coming back from the pandemic, schools were opening up. In the Quincy area, where there's 60% of the population were Asian, majority of the parents decided not to allow their children to go back to school. And when they were asked why, they said they did not feel the school, the teachers, the principal could protect their children. Asian Americans who express racism, they were said the heightened symptoms of depression and anxiety of stress and physical symptoms. And 1 in 5 displayed racial trauma and PTSD symptoms. So when I started to ask parents, what makes it hard for you to have these conversations? Or what makes it hard for you to even ask the questions? These were more of the typical responses. They don't know what to say. There was discomfort in having such a conversation. Many said they feel unqualified, and that's why they were hoping that as a teacher or a doctor could help them. They don't want to traumatize their child or re-traumatize their child. And the last one, these think the kids were too young to be aware of racism. Now, as we know from research, right, that 6-month-old infants notice differences in skin color. Toddlers and children under the age of 5 can detect messages and ideas about race. Children start to internalize messages about race from adults, and that by age 5, children can associate racial characteristics with traits, stereotypes, and social status. We started to have to remind parents, your children know, or they're sensing something, but we're not having these conversations. The research shows that Asian parents are the least likely group to actually have any of these conversations. Christina, you talked about from a very young age, right? That we need to start younger and younger. But parents did not realize that, right? And so so a lot of times we provide that psychoeducation. Your child notices differences. They just don't know how to think about it yet, right? And so really it is our responsibility to be able to show them that we can have these conversations, it's a safe place. So in 2020, I received a grant from the Community Health Network Area Channel 17. And this was the beginning of this idea of creating an adolescent parent guide. Because of the clinical experiences I was hearing, the stories I was hearing, I really felt impelled to inform and educate parents, adolescent parents. How do we start having these conversations? So from that, we were able to translate it into several different Asian languages. So you see here is English, there's Vietnamese, there's Korean, Japanese, Chinese. For the Chinese, everything was we had to also translate into simplified and traditional, all right? The main components of the parent guide was providing the history of anti-Asian racism and civil advocacy in the US. I don't have all the whole guide up, but it was very important that we start to talk to the parents. This country, there is history of description racism among multiple groups, and they were against Asians. We wanted to start educating them on several key components. And on the flip side, we also have a timeline of incidences where Asians stood up and advocated for themselves. So it was affirming, it was saying that we Asians do speak up. And so those 2 pages are very critical. As we were doing our trainings, whether to parents, guidance counselor, whoever wanted the training, they're like, I never knew this. I grew up and I was educated in this country. Half of that timeline, I never heard about the Asian American experience. And so as we've seen more recently, there is a push to do a better job of providing history about Asian Americans in the schools. But again, if I had to learn about it, then we were saying our parents do not know about it. But that was so key because as adults were hearing about it, they said, oh, I wish I knew about this. I wish I had a conversation with my child when they were younger. So they did. So they talked to their adult children like, yeah, Mom, I experienced it. And Mom was like, well, why didn't you say anything? Because you wouldn't listen, or I didn't want to burden you, or I was afraid to tell you. And so again, these are the same responses that we're getting. We wanted to show the importance of having conversations about ethnic racial identity and racism at a very young age. How to start the conversation with your child and adolescents, and we'll see some examples of that. And then at the end of the guide, we provided a lot of resources. So this is just an example. So I put up for the English and the Vietnamese. So one of the pages said, let's start listening and learning. So we encourage parents, create opportunities for your child to talk. It's not like you just look at them and said, because it's like, how was your day? Or tell me anything happened. The child will not, most likely will not know what to say, right? So create moments when you're driving in the car, at the dinner table, whatever it is more natural, and just check in, hey, how was your day? Right? Because these are not familiar to the children to actually have conversations with their parents, right? Be curious and respectful. I know for not just Asian parents, for many parents, we want to problem solve, right? Well, you should do this, you should that. We are teaching the parents just sit back and just really listen to what your child is saying. And then, or bring it up yourself, right? And so again, so it shows the child, the adolescent, that you're open to actually having a conversation, but if you can bring it up first. Validate feelings, acknowledge that it's real and it's happened, right? And encourage their voice. So again, what is so unique about this is that we talk to parents, we talk to adolescents, and this is what they told us. So everything in the guide actually comes from the parent or the child voice. I love this page. So it's a reminder to all adults, don't react. Don't judge. I love this one. Keep your face neutral. We all know what that means, right? Because, right, they look and they freeze because your face is like, what are you doing? And a lot of the adolescents had fun with that one. But the initial thing when the adolescents would say that I would try to talk to my mom or dad, right, the typical response is, what did you do wrong? You must have done something for that to happen. And that shuts down the conversation. Right? Don't tell kids and teens what they should or shouldn't feel. Just listen. Listen, be curious. And oftentimes we encourage the parents to say, I'm sorry that happened, or I really don't even know what to say at this point, because it's like a shared, like, let's work it out together. Let's talk about what we can do. Right? And then, I really can't see this, but so ideas to start the conversation. So some of the adolescents said to me, oh my, I can't see this. Is there a way to enlarge that? Okay. Okay, I really can't see it. So there was one that actually was like, for the parents to say, how do you feel about being an Asian? Or what, do you feel there are differences? Or do you feel that it's different at school? So these were, and if we can see it, there was like really good from the adolescents, like if my parents asked me this, I would tell them. So that was really cool. It was like from the adolescents themselves. And then what we did was the further research. So I just want to give you a brief example of what the guide includes. And again, this has been translated into several different languages. And then my students at William James have been so inspired, and they found this was so important that they also then adapted into other languages. And so this we just debuted. It was debuted as written in Arabic. However, a lot of it had to change. It was adapted, right? So because of the history need to change, the conversation starters. But again, students or people were saying, wow, there is nothing like this in my community. Right? So it's now in Arabic, and we will have it for Hindu and Urdu soon. And then when I did the adolescent guide, parents were coming up to me and said, can you do one for toddlers, preschoolers? Can you do one for adults? Everyone wanted a guide for something. And so one of the students at William James actually created a guide. It is in Vietnamese for American preschoolers. So as you can see, this is such an important tool and topic. And yes, the pandemic happened, but we need to continue having these conversations, right? It shouldn't be that we have to wait for someone else to talk about it, but how are we talking about it amongst ourselves? And then I'm going to talk about another study that I've been a part of. So this was a collaboration with Dr. Judith Scott at the BU School of Social Work with Grace Su and Yo-Yo Yao, who were both at the Boston Neighborhood Chinatown Center, which is a local organization, and myself. So when we got together in the spirit of the pandemic and talking about helping parents having these conversations, we did another project. And it was really on exploring the experiences of racism and ethnic racial socialization, so ERS, among Chinese and Vietnamese immigrant families with elementary school-aged children. So for the definition of ERS, the process of transmitting information to children about race, ethnicity, cultural heritage, and group social status. The hope is that ERS will reduce racism-related psychological distress and buffers associated mental health risks among children. Remember in the beginning of my talk, these were the things that were impacting our children from the very beginning, right? And so we wanted to, what can we do to instill cultural pride, cultural identity, and help the parents talk about racism with their children? A lot of the parents were reluctant to participate in any study, but also we found was that language was a barrier. Mostly everything in research is in English. The pressure of the model minority myth. Many of the Asian parents like, how is this a problem, right? We do want our children to excel, right? Internalization of meritocracy, belief that hard work and the sole path to success may obscure systematic racism. So they're instilling these thoughts to their children. So we wanted to break it down. Unfamiliar with US racial society, about the history, and discomfort with research participant. We started this project in 2022. We finally finished it this year and starting to analyze it. And a lot of the barriers was everything had to be translated. So we translated into Vietnamese, simplified, and traditional Chinese. We chose children's books, Asian books, but they're all in English. So the research team actually translated everything. And then we asked them to do surveys on Qualtrics. We transcribed everything. And more importantly, when we moved with the children's books, we asked the parents to read a book to their child, but we can't assume that they're literate. So we auto-recorded it. So whoever does research, it is a labor of love. Everything has been translated, and it has been taken a lot to actually convince Asian parents or Asians to participate in research. They don't trust the system. They don't know how the information will be used. But we were very proud that we were able to get 11 participants between the Chinese and Vietnamese, and mostly females. All female participated, all adults, and the their child, we asked them to include one child 1st through 4th grade. What we put them through was initial focus group, and then it was a 6-week intervention activities. And then we had a post-intervention. Is that my time up? Okay, okay. Quickly though, initial results. 89% of parents strongly agree that they were satisfied, would recommend our project to other friends. 89% of the parents strongly agreed that they knew more about U.S. history about racism. And that 79% were more confident and comfortable talking to their children about racism. And I'm going to end on this one. When we did the post-intervention group, one of the mothers said to me, this was hard. It was like 6 weeks of setting time aside to interact with their child. But she said the one thing that she will continue doing is to cook with her son. She said, oftentimes I'm busy. And so, I don't want to have him cook with me because it'll be messy. But because of this project, she cooked with him. And she said it was the most life-changing experience for her because she was able to talk to him about the Vietnamese cooking and the food. And she said that's the one thing she will continue doing every weekend. So I will end on that.
Thank you, Catherine. I don't want to be rude, but also it's hard to do the time balance. So please forgive me. So we will have like around 5 to 10 minutes of Q&A. Please allow me to introduce our moderator, Dr. Dorothy Chin. She is an associate research psychologist with the UCLA Center for Culture, Trauma, and Mental Health Disparities at the Samuel Institute of Neuroscience and Human Behavior. And please, 2 speakers. Catherine, can you also come on the stage to answer the questions?
Okay, I'm going to have to do this quick. But so first, I just have a reaction to the Bronfenbrenner model, which, we all were, even 40 years ago when Toru and I were in graduate school together, we were taught that. But it's like the concentric circles, right? And in the middle, it says you. And it's like, that's already irrelevant, right? Because, because we're always a we, So anyway, so that's my comment about the Bronfenbrenner model. But so there's this wealth, of information that was taught, just right now discussed. And so I have a wealth of thoughts. But first I thought, well, there's a lot of, this is about culture, right? But it's really culture intersected with a lot of things like culture by generation, culture by class, culture by gender, and culture by, this is not interaction, but I just want to talk about art as well, because that was fascinating in the morning about art and the role of art. But first, generational status and generational change. And I just want to talk about, even within culture, there's such heterogeneity because, for example, this was just touched upon in the first panel as well as the second one, that, and I think it's unique to Asian cultures, is this desire for us to protect our parents, right? And the burden was touched upon by you, Catherine, as well as Christina. And so the kids don't get support because in the immigrant generation, the kids are parentified. And I'm sure you guys know that notion. And a lot of us were parentified. And so we have this burden to protect the parents. So we don't want to talk about racism or mental health in that regard. And then there's the first generation, and I'm sort of the immigrant and the first generation because I came when I was 8. And then there's the second generation, and I was thinking that, okay, so we were all had to protect our parents against us having experienced racism because we don't want them to know that we experienced racism because they're just trying to survive, And so with my kids, I wrote, I also blog for Psychology Today, and I wrote this article about giving my kids a parenting evaluation because I felt like, okay, I always give my students a teaching evaluation. So why don't parents give, they're the ones who know the most, right? Just like students know the most. And so I gave my kids a parenting evaluation, and then I wrote about it, and that was like the most clicked article. And then so of course, then a lot of people said, I would never ask my kids to evaluate me, like those of the earlier generation. They're getting what they get, and so I just want to bring that up to you guys about the generational differences. And my kids did evaluate me, and then I wrote about it, and they were very nice. And so So what do you think about that? You know, these generational differences and how that plays out in our culture. And we have to do this really fast. 1 minute each, okay, no more. Okay, anybody want to take that? I could just take it.
I think in terms of early childhood education, I think it's well, in the early childhood way, it's when the child says no, that's an evaluation, right? Because they, I mean, 5-year-old or 3-year-old don't know how to read yet. But again, it's to, like, I learn a lot from my kids, and I think it's how can parents be humble enough to learn from the cues of the kids, right? It may not be a written evaluation, but when they react a certain way, they are telling you something, and how does that mean? And I think that's how our mental health consultation is about. It's how the teachers and the parents to be able to listen to the nonverbal evaluation of the kids on an ongoing basis. Now, it may not come naturally because you were not taught that way or your parents never treated you that way. But I think that's what the intention of attunement is.
So you almost stumped me there. I was like, oh gosh. So I think like when we're talking to first generation immigrant parents, right? They were like, well, I was raised this way and this is how it's going to be. And then obviously when the second generation, they raise their child very differently, less because they were enculturated in a much westernized culture. But for the immigrant parents, and I actually asked my mom this too, so I took a little risk. And I said, but Mom, I know you were raised this way, but how would you have wanted to be raised? You know, did you wish that your mom or dad asked you or like, you know, taught you different, whatever it was? And she actually sat back, she goes, well, yes, but I couldn't say anything because I can't talk. Boy, you really don't want me to talk. But I think about that. And so I think that I asked the immigrant parents, like, yes, you were raised that way, but what could have been different? What would have been different for you? And I think that helped with the conversation.
Okay, and thank you. And I know that, Brian, you can hear me. I don't know if you can see me. Would you like to add to that, or do you want a question just for yourself?
Just quickly, I think that some of the theme is empathy. So, you know, ways to open. Yeah, like in my work, dealing with intergenerational conflict, it's been a lot of conversation around how to build empathy within family, even among family members. I think that it's often overlooked and grazed over, but you know, sharing space, sharing stories, and I think that's been coming up a lot in this panel discussion as well. So just ways to develop opportunities for empathy to be shown to each other. I think that's been really helpful.
Yeah, so just to follow up on when this article of mine came out and all these parents read it, then the question to me was, can you give me a questionnaire to use so I could, you know, ask my, and so that goes to what your work, Catherine. But, you know, the way I did it was just a conversation. And, you know, I said, you know, how would you characterize my parenting? Because I'm a researcher, right? And they're 10 years old. They said, characterize? And I have a notebook, you know, writing it down. And I said, yeah, you know, do you think I'm a cool parent? Or what? Then I gave prompts, like the interviewing, you know, techniques that we use. So anyway, so another question is, okay, it's on class, okay? So, you know, generational status and class. Okay, I want to touch upon class. And so as context, you know, culture is so overriding, right? And just because you're with people of your own culture, it doesn't obviate the experience of trauma. And I say that because I went to elementary school just with all Chinese people. It was Chinatown, San Francisco, all Chinese people, right? And so when, Brian, you put your prompt up that we could not really type to, I had no awareness of anything identity, not because I was the only Asian among white people, it's because we were all Chinese. Why do we have to talk about race? We were all the same race. But the lack of, the trauma came from, acculturation and immigration status because I could not speak English and didn't know anything. And so I was actually bullied by more acculturated Asian Americans. And also with class, because they had these nice jackets and everything, and I had pants that were too short, coming from Hong Kong and stuff like that. And class is actually more salient to me actually growing up than race, and continues to be. So I went to a very exclusive, private college and so forth. And so can you guys speak to how class differences affects your clinical work as well as, what you're studying? Brian, in terms of, you're talking about gender, right? But class probably, affects that, influences that as well. Any of you can start.
Since I got the mic. One of the previous director of the Fuyao Project, we talk about class a lot. And working with the immigrant families especially, it's sort of become a melting pot of class, interestingly enough, because of immigration, because there are, when we work in Chinatown, there were families that were in upper class, and there were families who were in farmers, and they all ended up in Chinatown. So this is really interesting to work with a mixed class of a group of immigrants, and they became a melting pot of just identify as Chinese immigrants. And how they show up in the classroom and the expectation of the children, and the communication style, and how we work with that, and especially the ones who were in upper class and coming to America have actually dropped classes because the license, if they were doctors, the medical license don't apply in the United States. So it's not only about class, it's about the class changes because of the immigration and how they have to deal with the loss of the identity.
So, as I said, I've worked in the community health center for 25 years, and early on, a lot of the families or individuals, if they had moved up a class, right, they're no longer low income, but they were able to go into middle class, they actually didn't want to come to a community health center because they felt, one of two things. One, they didn't want to take up a space for someone else who did not have or low-income insurance, but they also felt that being in a community health center, that showed that they had not moved up, and they didn't want to be stuck in that immigrant identity. However, more recently, I think because of our ability to have that cultural and linguistic familiarity, it doesn't matter what class. They will come back to say, you're an Asian face. I don't have to explain so much, you get it. So I think more recently, I don't see that. I see that less as a barrier, but that they're coming back because they're seeing people who look like them, who can understand them.
Brian, do you want to add to that?
Yeah, no, those are great points, and I think that in some of the research that we've been doing, class has been really gone under the radar, and I think that that's usually been the case. But in the participant stories that we've heard, class has been the driving factor that breeds within group maladaptive competition in a lot of the ways, and so they've talked about model minority myth and internalized model minority myth and stereotypes actually intersecting significantly with class too, because that drives this notion that I would like to be that model minority who is successful economically, well off, and I'm the leader of something, right? But then they all have come to this realization that there's a bamboo ceiling at the end of that tunnel, and then they start to have some reflections about what this process community actually then hampers any interventions or models that we even try to do, that's actually having a community that's not collectively shared or in solidarity, then that also makes those efforts less effective.
Yeah, that's a great point. And the next one, I think I'm going to start with Brian because of your. When I first saw your slides, I was so happy, that because it focused on men and Asian American men, and I think that I have a father, I have a brother, and even though I have a father and I have a brother, when the thing happened with Jeremy Lin, Jeremy Lin, I'm a big basketball fan, but what he went through was so shocking and atrocious to even me. I've heard him referred to as the Jackie Robinson of, Asian America in terms of basketball. And there was actually a Sports Illustrated article that talked about his penis size. I mean, you should read it. It was shocking. As a put down, and so I wanted to just say, I don't even know if I have a question, but this is so shocking, and there's a lot of women here. I guess this question is even for Christina and Catherine, is how can women, even women that we have family members who are men, how can we be more of an ally, or just be more aware of what's happening to our brothers and our fathers, and Brian, when you said at the end of your presentation about clinical interventions, and you said, well, when they come in, and my thought is they're not coming in. Men are not gonna. Not to cast doubt on your presentation, but can you say more about that? Because I don't see them going to therapy and so forth.
Yeah, so I kind of mentioned that as if if and when, right? But I have some colleagues who do run Asian men groups, and they're able to really, in small doses talk about it. But as I mentioned in the talk too, it was really pulling teeth to even get them to talk about their stories about this experience. And so we had to actually do several sessions of interviews because there was no way they were going to talk about this in the first session that they saw us. And so, the fact that they actually talked about it with us, we were really grateful about it. But that's exactly what the process was like. There's so much shame involved that there is no way they're going to be just heading into a general therapy provision, center and talk about these kinds of things, especially if it came from a person who looked like the person who were perpetuating those remarks and sentiments. And so honestly, I think I think that's a great question, because we haven't even talked about in our research, what we found is allyship between other racially minoritized men, and so being able to create allyship there. But we haven't talked about, they haven't mentioned anything about allyship with Asian women or their sisters or moms and aunts and things, because one of the participants, for example, even said that even within their family, that their sister was actually saying something about it. And so, and for that reason, I'm kind of curious what Catherine and
Christina?
Christine would have any thoughts on this, actually.
So you're right. Majority men do not come in, or a lower rate than females. However, in the time that I've been doing clinical work, there have been a few males, and in one particular young man, he talked about feeling emasculated. So he's either, Asian men are either emasculated, asexual, or they're the kung fu master. And so he did talk, and so he's had a very difficult time entering into relationships. And so I think that, and again, he can't talk to his parents, he can't talk to his friends, because he said, no one will really understand my experience. So the work that I do, I think, is trying to be reparative, is being from an Asian female perspective and giving him, and just talking and validating his experience. And from a female perspective, saying that you are important, or I do see you. And so again, that's just one example of the work that we can do in the clinical world if they do come in and talk.
again, I'm focusing on the childcare level. I think one way to get parents in, there was a childcare center that has a fathers group, and they start with reading the newspaper and talking about news. That's what immigrant men will talk about. It's news, but then you get them into the room and start a conversation.
Oh, that's really interesting because, my father always read like 6 Chinese newspapers, as all our dads did, right? Okay, so finally, I don't want to, go over time too much, I want to talk about art. And I was so moved by the first panel, because everybody was doing some kind of art, and I think of it as both the process and the product, right? So the process, as we know from literature, is making art inhibits anxiety, probably inhibits depression too. And that's why, recently there's all this adult coloring books, right? You color the mandala, and everything like that. Because now it's known that, art is helping in process. And the product, though, is a manifestation, of a lot of things. And so I was thinking when you guys were talking, and you too, is art possibly, because I'm talking about all these subgroups within our larger culture, is art maybe a universal language that can transcend all these things that I'm talking about, transcending generations, transcending class perhaps even gender, and at least being an agent of starting the conversation. When my father retired, he started writing poetry. I was like, "You write poetry?" My father was a billing clerk in a hospital. We were like totally working class, and it turns out he wrote poetry. So it's like different generations can still share art, and let's think about class and all the other things too. So let's have you guys comment on that, if you will. And I know this is like my interest, but I'm making them comment on, and I'm going to make you guys comment on it too. So if you have any comments, look at their dubious faces. She's like, where is she going with this? But you probably use art in your clinical work, right?
Well, with youngest children, of course, that's art therapy. It's art. It's as long as it's not judged. I think as soon as it's judged, it becomes not art and not the expression of self.
Yes.
Yes, we do art in the clinical world. Especially like for children and adolescents, but for adults as well. And so we do the coloring, do all the stuff. But I think one story I have is in the clinic that we do, we specifically chose Asian art of different mediums, and we have it around the different clinics. And I remember one particular one in my room, they actually chose a needlepoint that is done specifically in Vietnam. And I remember having a child and mother in my office, and they were both looking at that artwork, and the child just happened to comment, "Well, that's really nice, that's cool, right?" And the mom was like, "I used to do that." And so using these different mediums, right, that started the conversation similarly, like, "Mom, you were cool," right? But it actually was able to ask, like, this is a particular art type, specifically in Vietnam, and that actually brought them together. So we use anything and everything in the clinical world to try to engage our parents or the children.
That's a beautiful story.
Yeah, I was gonna mention similar things to what Christina said, and just in some of the work that I've done with Asian men is really actually capturing some great photos. Like I know that in the research world there's the photo voice, which is really helpful to capture those moments and share that with other folks, community building and coalition building around that. So them being able to capture some photos that really help them feel empowered in terms of even dealing with gender racism or other trauma experiences, and then just sharing that and having sort of a conference around it has been really helpful. And then that sort of helps to generate conversations about more storytelling, how there are shared experiences that nobody could have actually thought of before. And so just to round up that's been really helpful in terms of the art use.
Okay, yeah, that's really interesting. Photography is great. So now finally, it's your turn for the Q&A. I know you guys have been suppressing all the questions, so I don't know if we should just break for lunch or yeah. Okay, so we can just ask questions, during lunch of each other. So thank you for your attention. I'm sorry we went so long, and we'll continue talking.